Welcome back to the Wellness Script podcast, your source of truth for all things health and wellness. My name is Lauren O'Reilly. I'm a qualified pharmacist and your host for today. I'm joined by Emer O'Driscoll, a specialist dietitian in the Blackrock Clinic who focuses on women's health, including PCOS, endometriosis, and fertility, and is also an intuitive eating counsellor. In this episode, we're breaking down the difference between PCOS and endometriosis, what nutrition can and can't do, and how to support hormonal health and fertility without falling into restrictive diet culture. We'll also touch on supplements, misinformation, and practical, sustainable ways to bring more intuitive eating into our everyday lives. Emer, you're very welcome to the Wellness Script podcast.
Thank you so much for having me, Lauren.
So nice to see you, and I've been following your content. You put out such incredible information out there about women's health, so super excited to have this conversation. It's been highly requested to talk about PCOS and endometriosis. So I suppose maybe let's start with what got you into this space? Why are you so passionate about women's health?
Yeah, absolutely. And I'm so honoured to be here, and I just love talking all things women's health. I could talk about it all day. So I'm very, very happy to be here. But I suppose how I got into this space was I trained to be a dietitian. I was always interested in science and nutrition. So it was amazing when I found out there was a job that could blend the two of these together. And when it came to the women's health point of view, I suppose from a personal experience, I definitely experienced that over-exercising, under-eating, and how that then affected my menstrual cycle. I found it very difficult to find information on that and how to go about that. So when I found out as a dietitian that nutrition could have such an impact on that, that really spurred me on to learn more about it. So learned more about that, trained in the fertility side of things with nutrition, and also trained as an intuitive eating counsellor, which is all about healing your relationship with food. So I just found that with females, there was definitely a space for that. There was definitely a want for that. So that's how that's all blended together for me.
There's so much in there, and we're going to touch on each of those for sure. I think maybe a good place to start would be with, because I've genuinely gotten so many messages since starting the podcast about, can you do something on PCOS? Can you do something on endometriosis? Maybe let's just talk about what are those conditions, how do they present when people come to you? And how does someone get a diagnosis?
Yeah, absolutely. Great question. And I suppose let's start with the PCOS firstly. So PCOS stands for polycystic ovarian syndrome. So it's a complex hormone disorder. So I think a lot of people would argue that it's poorly named. It does have a lot to do with the hormone conditions to do with your menstrual cycle and your ovaries, but it also has a lot to do with the hormones in your brain and the hormones that control our blood sugars in our body, so the insulin. So we don't really know the exact cause of PCOS, but it's definitely thought there's some genetic factors and how your body processes insulin has something to do with it. And when it comes to PCOS, in terms of the symptoms that you would experience, irregular or absent periods, definitely fatigue can be a symptom as well. And you can have hair growth where we wouldn't normally experience that with females. So hair growth on the face, on the navel, on the nipples, that's called the hirsutism. And then you can get the alopecia at the top of the head. So the hair loss actually on the top of the head. People find it very difficult to lose weight. So there's definitely some mental health and anxiety can go in with those symptoms as well because of those other symptoms. Infertility, fertility issues. So how we diagnose PCOS is actually very interesting. It's through the Rotterdam criteria. So there are 3 criteria and you need to meet 2 of the 3 criteria to get a diagnosis. So one of the criteria is irregular or absent periods or menstrual cycles. And the second criteria would be high levels of androgens. So androgens are your male hormones. So we all, females and males, have female and male hormones, but just the male hormones are usually higher in males, female hormones usually higher in females. But with PCOS, you can have male hormones like testosterone, which are higher. So this can present either in, like I was saying, the hair growth in the face and on other parts of the body, or looking at the blood tests as well to see high levels of androgens in the bloods. And then the third criteria would be through an ultrasound where you would see cysts on the ovaries, so a certain amount of cysts. And what's very interesting is you just need to have 2 out of those 3 criteria. So you can have cysts on your ovaries, but not have PCOS.
Okay.
And you can have no cysts on your ovaries, but have PCOS. Because if you have irregular absent periods and high levels of androgens, that still meets the criteria for PCOS. So it's all about making sure that you are going and getting a proper diagnosis.
Okay.
And getting your bloods checked, speaking with your doctor. And then when it comes to endometriosis, so endometriosis is a chronic inflammatory disorder.
Okay.
So again, we don't know the exact cause. There's thought to be some genetic factors linked in there. There is no cure, unfortunately. For either condition, it's just about using nutrition to manage that. Okay. So when it comes to the symptoms of endometriosis, you're looking at pain being one of the most common symptoms. So painful or heavy menstrual cycles. You could have pain during or after sex, pain during or after urination or bowel movements, chronic pelvic pain. Similar to PCOS, you're looking at some fertility issues there, fatigue, again, similar to PCOS. Because of all these symptoms, you're looking at anxiety, mental health issues. And because there is, I suppose, an overlap of symptoms with many other conditions like painful periods, it's very difficult for people to realize that they have endometriosis. Okay. So a lot of people that will come to me with endometriosis, they have been on a very, very long journey before they get to that point. Okay. So I would always sit down with someone and say, tell me exactly how you got here, because I know it wasn't a straightforward road for you. So when it comes to diagnosing endometriosis, what you're looking at first line is the doctor will kind of do a symptom profile and gather all of the symptoms of, say, the pain or the infertility, and will likely send you for a non-invasive, so something like an ultrasound to see if there's cysts there, an MRI to see what you're dealing with, how deep the infiltration is for the surgeon, whether the bowel or the bladder are involved. Okay. But really the only way to properly diagnose endometriosis is through surgery. Okay. So laparoscopically. So they're surgeons making a tiny little cut incision and they're going in there with the camera to see what's going on. When they're in there, they'll take a little biopsy and test that. And, you know, a lot of specialists will do the see and treat method. So if they're in there and they see the endometriosis, then they can remove some of that tissue. Okay. So with endometriosis, you're looking at that tissue that is similar to the lining of your womb or your uterus growing outside of the womb of the uterus where it's not supposed to be growing. So the bowel, the bladder, and that's what causes those symptoms like pain.
Omega-3 is one of those supplements that I genuinely kept up taking over time. I first started taking Sona's Omega-3 around the time of my laser eye surgery, and I've kept it up ever since. Sona Omega-3 contains EPA and DHA, contributing to the normal function of the brain and the vision, as well as to the normal functioning of the heart. And it also contains vitamin E as an antioxidant. Sona are offering an exclusive gift for listeners of the Wellness Script podcast. So when you make any purchase on sona.ie and use the code SONAGIFT at checkout, a free gift will be added to your order while stocks last, and terms and conditions do apply and are below in the caption. Now, let's get back to the episode. Okay, a lot of people describe that growth of the uterine-like tissue as being almost like Velcro, like as in that it's adhering to different places inside the body and causing that inflammation and pain. And I suppose when people do come to see you, they have that diagnosis. Yeah, and as you said, it's managed largely through the diet. Maybe like that wouldn't have been something that we covered hugely in pharmacy, you know, in college. So like that's so interesting that we can actually impact a condition as I suppose extends, that it affects so much of our body through our nutrition. So I suppose, what does that look like then if somebody comes to you as a dietitian to manage their, are there some things that work for everybody as a rule, or is it very personalized?
It's very personalised,
Okay.
absolutely. So, there's definitely an overlap with the two conditions. Over general, you're trying to bring down inflammation. Inflammation is so high in both conditions. So looking at that anti-inflammatory diet, but definitely there is no one size fits all diet for either condition.
Right.
And when you're looking at PCOS, what I always like to do with both conditions, with PCOS and endometriosis, is sit down and explain to people what the condition is, because you should never, as a healthcare professional, assume that just because someone's been given a diagnosis that they understand exactly what that condition is.
Yes.
And I think if you understand what's happening in your body, it makes it a little bit easier to understand and understand how the nutrition can help.
Yes.
So with something like PCOS, what we're looking at is tackling the inflammation, tackling bringing down any stress in your body, and tackling regulating your blood sugar levels. So with your blood sugar levels, there's a hormone called insulin that controls the blood sugar. So when we eat food to get energy, that food is broken down into that sugar, that energy, and it needs to go from the blood into our cells to give our cells that energy. But with a lot of people with PCOS, it's very difficult for that blood sugar to get into the cells. It's like that insulin or that key is broken, can't get into that lock.
Okay.
So what happens is the blood sugar, it's building up in the blood, and that can cause those symptoms. So we're looking at regulating the blood sugar levels with PCOS. And one way how we do that is to make sure that you're eating regularly. So as a general guideline, I would always say, make sure that you're eating every 3 to 4 waking hours.
Okay.
I see a lot of women who, we're so busy these days. We're running around, we're skipping lunch, we're having coffee for breakfast, and then we get home in the evening and maybe we just kind of sit down and then say, oh my goodness, I'm starving. And you haven't nourished your body properly. And that gap, so that over 4 hours, that's what causes the blood sugar levels to dip.
Okay.
And then what goes down must come up.
Yes.
So you're searching for something like a biscuit, like something sugary that'll make you feel better and spike those blood sugars up again. That roller coaster that we're on, that really wreaks havoc with your mood and your energy. So that would be the first step that I would go through somebody with their diet history. But what time are you eating that at?
Yes.
And also looking at the pace of eating.
Okay.
So really, we've gotten very fast.
Definitely.
We really have. It's really something that we are living in, that busy, fast-paced, instant lifestyle that even if we have an hour for lunch, we could just be, it's gone.
Yeah,
in 4 or 5 minutes. Or
if I have a spare hour, I'll fill it with something else, and I'll just eat at my desk, and I'll be like, oh, I can do this blog post, and I'll eat while which is so silly because and you feel it instantly that you're not relaxed, you're eating, you're expecting, the two modes I suppose that we're in as humans are fight or flight and rest and digest. You can't digest 100%. And be in fight or flight at the same time.
100%. And how long would it take you to eat a meal, would you say?
Oh, so I'd say less than 10 minutes. Yeah, definitely.
Yeah. So what we're aiming for is your meals 15 to 20 minutes.
Yeah.
So if you're somebody that eats it less than 10, even if say, could I stretch this out to 15 minutes?
Okay.
And, it's putting the knife and fork or the sandwich or whatever it is down, taking a breath, because oftentimes we have the fork loaded up here ready to go and we haven't even chewed and swallowed what's in our mouth.
True.
And your stomach doesn't have any teeth, so you're giving it a tough job. And sometimes people will suspect maybe some intolerances or that food doesn't agree with me, but a lot of the times it can do with pace and are you actually chewing the food?
Yes.
And you're so right about the rest and digest and fight or flight, because that fight or flight is that adrenaline, that running away from the tiger, the blood flowing to the head, to the arms and legs to run and fight. It's not thinking about what you're going to have for lunch, how much you've digested something. Really important to have a certain amount of adrenaline and fight or flight. But I feel, particularly as women, we spend too much time in fight or flight, not enough time in rest and digest. And I'm convinced that's why so many young women these days have digestive issues, fertility issues. There's not enough of that rest and digest, the blood flowing to the trunk, to the reproductive system, to the digestive system.
Yes.
So even something as simple as slowing down can really help to balance your blood sugar levels. Yes. And then looking at making sure that we have enough protein in the diet as well to balance the blood sugar levels, particularly at breakfast. I see a lot of people maybe grabbing a coffee, maybe grabbing a slice of toast, maybe having a bowl of oats made on water. Yes. No protein and healthy fats in there to slow down that release with that blood sugar. And looking at bringing down that inflammation as well. We want to, which we can touch more on, we want to bring in all of that lovely anti-inflammatory food, particularly the omega-3, the oily fish, the nuts and seeds, the whole grains. And the same would go for endometriosis as well. You're looking at trying to bring that inflammation down, trying to bring the stress down in the body, bring the cortisol down. And with endometriosis as well, hugely estrogen-driven condition. So how we eliminate the excess hormones from our body, so if there's too much of a buildup of estrogen, is through our bowel movements. So if we're constipated, if we're not going regularly, we're kind of not getting rid of those excess hormones and they're reabsorbing. So it's looking at making sure that your bowels are all functioning normally. And a lot of the leafy greens like your kale, your spinach, your broccoli, your Brussels sprouts, they're really good at mopping up that excess estrogen as well. So those are just nice things that we can look at from a general point of view with both conditions when it comes to diet. But I would always take the person as an individual and always sit them down with asking, what are your goals? What do you want to change about your diet? After going through your diet history with me, what do you see maybe that you would like to make some changes to? And going through very much the rest of their medical history. So very much always take it on an individual approach.
And that's really interesting because before we started recording, you told me about how much it's so important to focus on your diet when you have a condition like PCOS or endometriosis, or in general, if for women's health or anyone's health, but how it is largely managed through the diet, but so few people have seen a dietitian. Is that right?
Yes.
There's a stat that you
Absolutely, yeah. There's a really interesting study that shows that with PCOS, 65 to 70% of people with PCOS are on a diet, and only 15% of those people have seen a dietitian.
Yeah. So where is the information coming from then? And I totally understand how and why you might feel the need to be resourceful. Maybe there's a waiting list to see a dietitian, or different reasons why people might resort to to online resources. But I think it's so important, at the very least, if there's information online, that you're getting it from a reputable person like yourself, like a dietitian, and that then also remembering that it's not a blanket approach. It's very much like your nutrition that needs to be tailored. You mentioned also there as you were speaking, and I think it's an area that you specialize in as well, is the fertility piece. So how does that come up for you in clinic? With is it only in relation to PCOS and endo, or is it generally the diet as it relates to fertility?
Yeah, it can be a mix. Yeah, definitely. So people can be coming for fertility issues and not have any diagnosis of PCOS or endometriosis. And then people can be coming for fertility. They're having fertility issues because they have PCOS or endometriosis, and they want to know how diet can help. And it's such a fascinating area. I love the nutrition and fertility piece, because I think it really empowers people when you go through their diet with them and what they can do. And usually when I'm looking at somebody who is having fertility issues, I want to start with the story and how they got there and how they are feeling. There's a huge amount of blame when it comes to fertility, and there's so much misinformation out there that it can be so overwhelming. It can be so costly, both financially and emotionally. So usually when they get to me, I'm kind of further down the line, that they've been through a lot, they're frustrated. So what we will usually look at is, whether it's somebody with PCOS or endometriosis, or just somebody who is looking to get pregnant and struggling with that, it's looking at we want this to be a safe environment for an embryo to grow. So what you need for a successful pregnancy is you need the healthy egg and the healthy sperm, them to meet, create an embryo, and the embryo to have a nice little cozy, safe home that they want to grow in.
Yes.
So it's looking at very much the holistic approach. So yes, nutrition and diet are something that I would specialize in and I'm so passionate in. However, that's just one piece of the puzzle. So I always say to people, there are 4 pillars of health. You have your nutrition, you have your sleep, you have your stress management, and then you have your exercise or your movement. So you could have this amazing anti-inflammatory, by the book diet, but if you're not sleeping, you're stressed up the walls and you're not doing any movement, they're not really going to complement each other.
Yes.
So it's looking at the person's lifestyle as a whole. And, you know, are you somebody who's skipping meals? Are you somebody who's drinking 4 or 5 coffees a day? Are you somebody that's doing really high intensity, like HIIT workouts? And is that really fueling your goals for fertility?
Okay.
Looking back on the day and saying, have I nourished myself? Is this something that if I am successful to get pregnant, would I be eating and acting this way? So it's looking at that eating and acting as if you already are pregnant, making sure that you're getting your balanced meals, you're eating regularly, you're doing a mix of exercises that aren't putting too much stress on your body, your caffeine levels aren't too high. So really it's looking at all of those factors. And then also what I'm really interested in from a fertility point of view is what has been tested, what hasn't been tested. So even things like, you know, a vitamin deficiency, whether somebody's been tested for celiac disease, whether their thyroid function is optimal. So your thyroid stimulating hormone, your TSH, usually that's only flagged as high if it's over 4 on your blood test, but there's a lot of evidence to show that specifically from a fertility point of view, it should be under 2.5. So it's looking at all of those pieces saying, has this been checked? Has this been ruled out? Because I think in all other areas of medicine, there's no other term that's accepted as unexplained, but unexplained infertility just seems to be this accepted diagnosis. But in my opinion, it just means that we just haven't tested or we haven't checked enough things or we haven't looked at the stress element of things, the diet element of things. And also what I think is really interesting when I see females is if you have someone who's in a heterosexual relationship, it's what is your partner doing?
Yes.
You know,
Yes.
how's his diet? How's his stress levels? You could have someone who's saying, you know, I've started doing my yoga, I'm eating regularly, I'm taking all of the supplements, I'm doing everything I can. And then, you know, he could be doing nothing, drinking every night, you know, and it's looking at, it takes those two. So it's looking at, you know, maybe you want to bring him in for a consultation as well, or maybe we want to look at that side of things. So that's a very important aspect that I think a lot of women don't realize makes a big difference.
Yes, absolutely. I think there's a huge blame or self-blame kind of element. But actually what I take from what you're saying is there's a huge empowerment piece as well. But as long as you are recognizing that it takes two, obviously, to make a baby. But the piece that I think is really interesting is that unexplained fertility that you're saying that it's not like, okay, well, that's you, that's the label that you have. It's actually that, well, we need to investigate more. And I know you come from a biochemistry background, so you're thinking about bloods and the TSH, which is fantastic because it's kind of like detective work then, isn't it? Like trying to get to the bottom of it. And that kind of can give people hope, I suppose. And to me, it's really interesting in terms of that we can actually, like, away from the blame point of view and more towards the empowerment point of view, we can influence, you know, things like, I suppose that relates in our body to things like ovulation and, as you said, the environment that an embryo has to find a home in. So I think that's a really kind of empowering kind of piece. And when it comes to, I suppose, fertility and everything else, with the unexplained fertility, what it also makes me think of is if you weren't trying for a baby, you wouldn't have investigated this piece that may actually also be really beneficial for your health. So isn't it that we're probably in our in a very healthy place when our fertility is in a healthy place. Is that true as well?
Yeah, absolutely. Yeah, 100%. And, I think that it's really important to make sure that you are in touch with your body, with any symptoms, with any kind of family history that you have, to not be afraid to go to your doctor, to get bloods checked, to, I was talking to somebody about this the other day. Like, I would argue that there's no one that couldn't benefit, man or woman, from having a chat with a dietitian.
Yes.
And saying, how is my diet looking? Is it balanced? And then talking about, again, your stress, your exercise, your sleep. So I think it's so important for somebody to be proactive about their health in that way.
Yes, absolutely. And I think like nowadays there is so much information online, but as you said, whether it's man or woman or PCOS or endo or not, like we can't really just take a blanket approach. It's about, and even like throughout our lives, like what suits me now in my life stage in terms of my diet suits me now, but that could very much change in 10 years time. And then 10 years on from that, your energy requirements change, so it's all, you tailor it to not just you, but also your stage of life and how active you are, if you're training for a sporting event or, all that kind of stuff.
Exactly.
So, and I would imagine a lot of your work, you mentioned the psychological and the emotional element. I'd say there is a huge amount of, even though you're a dietitian and not a counsellor, there's a huge kind of therapy kind of element to what you're dealing with. Yeah. Is there, like, how much of your work is that emotional support piece, in terms,
Yeah, it's a large amount, definitely, because what I find is fertility, PCOS, endometriosis, a lot of the women that I see, it has not been an easy journey for them, whether it's that they have been waiting to see a dietitian or nobody has ever suggested that they go to see a dietitian, or they have been waiting years for diagnosis. What you will find, and what I certainly would do if I was in someone else's shoes, if I was having symptoms waiting for a diagnosis or had received the diagnosis, I'd be straight onto Google. We all would do it. And then you're getting that Dr. Google information where you're being told, lose weight, that's just your problem, or never eat this, or this is toxic, or don't eat these foods and you ruin your hormones. And they're going on and off and on and off these diets and not having any success. They're hugely frustrated by the time they come in the door to see me, which I have so much sympathy and empathy for people at that point, because they're at their wits' end. So I would hate if someone came into me and I just said, you have a diagnosis of PCOS, endo, infertility. Here's the diet sheet that I give everybody. I'll see you later. Yeah. So it is that, tell me your story. Tell me how you got here and tell me how you are feeling about that. And it's looking at their emotional piece of how the nutrition advice has to fit into their lifestyle. Yes. It has to be realistic for them. I'm not going to tell somebody who's a single mom of 3 kids who's maybe caring for an elderly parent that, you just need about 4 hours of food prep on a Sunday and then we'll get all these nice meals together. That's not going to work for that person. No. So in order to work together to make a nutrition plan, you have to know what's going on with them emotionally and psychologically, meet them where they're at. And when it comes to that emotional piece as well, sometimes people just need to be told that it's not their fault that they're in this situation. And what I think is really interesting from a psychological point of view, I remember I heard it was maybe about a year ago, and someone said, we don't spend enough time listening. There's so much time where people are just kind of waiting for their turn to speak. Yes. And I think that that's a hugely important skill for all healthcare professionals to really work on. But just people in general, I think that we just need to listen more. You're kind of waiting to jump in with the, oh, I know what will help you, or I know what will do. But sometimes it's just sitting back and listening. And I think that definitely feeds into the counselling psychological side of it.
Yeah, I did therapy a while back myself and I found it hugely beneficial. I think because the therapist just provided the space to she was literally just listening. And I'm I suppose it all goes hand in hand, but I'd be the kind of person who'd like, you know, like type A or whatever, and like kind of just get on with things. And like, I'd never like want to, I suppose, bother anyone or use up too much time like ranting or at one of my friends or whatever. So to have that kind of guilt-free space to finally say, you know, whatever. And what I found was I'd say something, then she'd just like kind of still be looking, nodding at me. And then I'd find myself, okay, I guess I'll continue. And then you realize you have the answers within yourself almost. And I know that it's different with a medical condition and your diet and everything. But at the same time, as you said, it's a whole person approach. So while you will guide them with their diet, they may realize, okay, as I'm speaking, I do realize that what I'm doing in my life is not sustainable from a well-being perspective. I literally don't have 30 minutes to sit down and eat a meal. That's a problem, not just for fertility or not just for PCOS. It's just like, I'm like just so stressed. So like, I think that having that space with someone, no Dr. AI or Google is gonna be able to replace that. So I'm huge for going to see a professional in definitely when it comes to things like that. And I suppose in a kind of as it relates to those conditions, but in a more general sense, you also mentioned intuitive eating and that being a pillar of what you work with people on. So I suppose, what is intuitive eating? Like, because maybe there's a lot of misunderstanding about what that means.
Yeah. There definitely is a lot of misunderstanding about what it means. And it's something I'm so passionate about. So I'm a trained intuitive eating counsellor, and what intuitive eating means is it's a gorgeous way of connecting with your body, separating out your emotional hunger from your physical hunger, healing your relationship with food. It's an evidence-based model, and it was founded by 2 dietitians in the States. So it's based on 10 principles, which is great. It means it's measurable. So we have a lot of research behind it. So usually with somebody who is interested in intuitive eating, I would start with talking to them about their relationship with food, what food was like for them growing up. Was there anything that was off limits? How many diets have they tried? How many food rules they still have? And looking at what their connection to their hunger and fullness is, both from a physical and an emotional point of view. So we would start by using something called the hunger fullness scale. So that runs from a 0 to a 10. So a 0 is that panic hunger that, you know, someone is going to get hurt if they get in the way of me and my food. It is very urgent. It is not pleasant. It cannot wait. And a 3 then is a real comfortable hunger. You know, we know lunch is coming up in half an hour. I'm looking forward to that. There's a few gentle signals there. It's not urgent. It's just pleasant. Hunger is the best sauce kind of feeling. And then when it comes down the scale towards the fullness, and the 7 is that very comfortable, that meal really hit the spot. I feel good. I feel maybe a little bit sleepy, maybe a little bit energized, just feel great after that meal. A 10 is the kind of heavy breathing. I really overdid it there. I feel a bit nauseous, undoing the top button of the pants. And what we want to aim for is entering a meal at a 3 and leaving at a 7. If you enter a meal at a 0, you have no hope of stopping at a 7. You're going straight to the 10. So
because the signals are thrown off,
exactly. And because when you're in such a state of panic hunger, that's when we tend to that's the I'm not chewing, I'm not even realizing, it's just go, inhaling. And that's where, when we're eating too quickly, it can be very difficult to recognize those signals. Or if we have been in that fight or flight where the blood isn't rushing to the trunk and giving us those hunger signals, we can be just working through our lunch. I'm so busy. Sure, I'm not hungry anyway, it's fine. And then you get home in the evening and, okay, relax. And then the blood starts to flow to the trunk and, oh my God, I'm starving. I'm at a 0. And then you kind of can't stop eating. You're trying to get those blood sugar levels back. So that's where the trying to eat every 3 to 4 hours is a really good training wheels to put on. And looking at sitting down and asking yourself before a meal, where am I? Am I at a 3? Am I actually at a 1? Have I let this go too far? And then pausing in the middle of the meal and asking yourself, where am I? You're not committing to stopping eating, but you're saying, am I at a 7 or am I actually more approaching an 8 or a 9? So it's looking at somebody tuning into those physical feelings of hunger and fullness, which people might have totally lost touch with, which is absolutely fine. We spend too much time in our head and saying, I shouldn't be hungry or I shouldn't eat this. And when we look at the emotional side of things, I think it's fascinating because I like to ask people where they feel an emotion in the body. So every emotion has a physical sensation in our body. So when we are talking about things like fear, like guilt, I'll ask, where do you feel it? And oftentimes the response will be, well, I'm kind of thinking about, that I shouldn't be doing this. And then I'll say, let's get out of the head, out of the thoughts. Where are you feeling it in the body?
Okay.
And oftentimes it will be in the chest, in the stomach, in the throat. And I think that's so interesting because a lot of the emotions that we associate with dieting or rules or how we feel about food, fear, guilt, shame, anxiety, we feel those down the digestive tract. So it can be really difficult to tune into, am I hungry? Am I full? If you have all these feelings of fear of, I shouldn't eat this, I shouldn't be eating this, or I shouldn't have done that. And so it's really separating those out for people, because there are a lot of women that come to me that struggle with binge eating, and particularly in the evenings, and they think that it's down to willpower, or that it should just be as simple as just get the chocolate out of the house, or I shouldn't be eating that, when actually it's looking at, well, what emotionally is going on for you and what are you feeling there, and is it loneliness, is it stress, is it not giving yourself permission to take a break? And that has been one of the most interesting things for me as a practitioner, of somebody realizing it's not a sugar addiction. It's not a lack of willpower. It's the fact that I'm struggling with loneliness, or I'm struggling to even admit to myself that I need a break and to give myself that break.
Yes.
So that's why I find intuitive eating fascinating, because the person really learns a lot about themselves through healing their relationship with food.
Wow, that is so fascinating, and it makes so much sense, Emer, because we know, like, the behaviors that are logically, we know they're causing us harm, or they're causing us to gain excessive weight, maybe things like that. But it's not just because we don't have willpower, as you said. It is that there's an emotional gap there that we're not addressing, maybe, or that needs to be like looked at more holistically. So again, this is where things like only getting information online can be the combination of the world we live in now, and having those like emotional blocks would contribute to the guilt that you feel, which actually probably even worsens the cycle. So and one thing I was thinking of as you were speaking is, like, that seems like a really powerful approach to healing your relationship with food, but one that obviously sustains because you understand yourself and your motivations and where it's all coming from. Where then does the like Ozempic and weight loss medications fit into that? Because it I can see how it would bypass that understanding piece, getting to just the end result without addressing the behaviors.
Yeah, absolutely. And I see a lot of women who are on those weight loss medications, and it's not that I'm against those medications. Everything has a place, but what maybe I am against is someone being given a script for those medications and not being told to see a dietitian who has experience in that. Because what they can do is they can reduce your appetite, they can bring up feelings of nausea, and yes, that can result in weight loss, because if you're not eating, you're losing that weight. But it's looking at, well, that's not sustainable, and that's not good for us either. So it's looking at, with this medication, that's not going to heal your emotional side of things in terms of your relationship with food. So it's not that I would be against those medications or saying people shouldn't be on them, but I think that you should take it as that holistic approach, and that a lot of people go on these medications saying, I want to eventually come off this medication someday. But if you're not tackling that relationship with food and looking at healing that and being educated on what a balanced diet is, which I think dietitians often take for granted that everybody just knows.
Yeah.
They don't.
No, all we've seen is like the food pyramid, which certainly doesn't fit everyone and needs a bit of revision, I would say.
For sure.
So definitely. And I'm the same. I'm not against them, and I see their role in managing obesity and things like that. But I do, it does concern me, the continuity of care in terms of, it's not intended, I suppose, to be something that you're on for life. It's supposed to address. But then when people come off of them, do they have that continuity of care, or is it going to revert back to old habits? More than likely it will, because you didn't address the psychological or emotional cause or other cause that's underlying. So it does concern me. And there are like online consultations and things like that I see coming through as a pharmacist, and then on the pharmacy side, we might take their weight and height and get their BMI and make sure that it's clinically appropriate, I suppose.
Yeah.
But we don't have the time I have had long conversations with patients who are on them if I had the time, if it was a quieter day, but that's not always possible. And that's where I feel like there's such a gap. And I feel bad when you just have to kind of give it to someone, tell them how to use it physically, like inject yourself, and then they're on their way. Yeah. And like, I'm just kind of hoping that there's a bit more, I suppose, counselling going alongside that to treat the whole person. So, that's why I just wanted to hear the dietitian side of it. I think it is really, really important. And Emer, I think as well with the intuitive eating kind of piece, how do you see that? Like, I suppose, how do you see that having evolved in today's society, with there's so much also online about ingredients like food labels and things like that. I don't know what to think about all of I feel overwhelmed, because sometimes you just need convenience and sometimes you just need to grab something to eat. So like, what would your kind of stance be on like finding, ideally we'd all be eating whole foods all the time, but where's the kind of, is there a balance we can find there?
Yeah. And it's so interesting because we have more information than we have ever had about food and nutrition. Yet we are the most confused that we have ever been. And people will come to me and say, I don't know how to eat anymore. I don't know, carbs are bad, fat is bad, ultra processed foods are bad. I heard too much protein is bad for you. What about intermittent fasting? Maybe I shouldn't be eating this, but then maybe for my hormones I should be eating. What about around exercise? There's so much information out there that it has left people so confused. And I think we need to shift the focus. We're spending so much focus on what these ultra processed foods are doing to us and to our body. It's causing a lot of stress and a lot of worry with people. I think we need to flip the focus on, what is that doing to our health? Yeah. The stress and the worry that people are having over these foods. I'm very much, my opinion is that overall balanced diet, when I think of a diet that's balanced, yes, I think of your foods that nutritionally you're getting a lot of bang for your buck. You're getting your whole grains, your fiber, your fruit and veg, all your colors, your plant-based proteins, your nuts and seeds, your dairy, your lean protein. And those are foods that you're getting a lot of nutritional bang for your buck. And then you have your foods like your chocolate, like your beans on toast. You're maybe not getting as much nutritional bang for your buck, but they're just good for your soul. Yes. And I think that if we have too much of either, that's not good for us. Yes. So it's looking at what is sustainable. So any diet that you're looking at, you need to ask yourself, could I see myself doing this in 5 years' time? And if the answer is no, then you need to put that to the side. And if it is this stress over poring over ingredients in the supermarket or feeling those feelings of guilt or shame eating those foods, then that's not something I agree with. And a lot of our approach in intuitive eating would be that feeling guilty over food, there should be no moral basis there to food. It's just food.
Yeah.
If you stole that food, yes, you should feel guilty. But if you eat what we label a bad food, that doesn't make you a bad person. If you eat what we label a good food, you know, brown bread, apple, that doesn't make you a good person either. It's just food. So it's looking at this connection that we have created with food, labeling it good and bad, then makes us feel like a good or a bad person. And it's looking at what that impact has on our health as well. So if you have an overall balanced diet where you have majority of the time that food, again, you're getting a lot of nutritional bang for your buck. But again, you're having that food that, you know, just makes you feel good, just as good for your soul. I think that that is really important to include as part of a balanced diet. And, you know, the way I feel about it as well is that stress and that worry and that guilt and that anxiety over food, I think is a lot more harmful to our health than consuming some of the foods that a lot of people are talking about online.
Yeah, definitely. I absolutely love everything you said there. And I think like one thing that I found, I love to have a treat, like, you know, every now and again. And like, it's just like, one thing I tried to improve was just when I want that chocolate bar or I want something as a treat, eat it mindfully, like not to inhale it, because like if I'm gonna have it, enjoy it. Like I'm gonna have my almond croissant, my coffee, and I'm not gonna scroll on my phone while I do it, because then it's gone and I wasn't even aware that I've had it, and I just spent €8 on it, you know. So like I just think if one thing I've learned about, like when I do fancy something, like pay attention to it, then I'm actually satisfied and I'm like, okay, I had my treat, really enjoyed it, like great, like great time, and then move on and then get back to your Whole Foods and whatever, it's grand, you know. So like I think as long as like we're mindful of what we're eating, which doesn't necessarily mean exclusionary. It's just like actually paying attention, and that's the slowing down piece that you said, which is, you know, just actually taking the time. And I think you get more enjoyment out of it actually. For sure, well, you know, for sure. And the other piece, and you did touch on it, was supplements. So that's something I get asked about a lot in the pharmacy setting and outside of it. So I suppose in a general sense, I guess what role do you see them having for our general health? And then maybe we could talk about endo and PCOS and how it affects there. Yeah, definitely. I'm sure as a pharmacist you get asked about supplements so often, all day. Yeah. And I think supplements are so interesting because there can be a lot of, again, misinformation online and things advertised of everybody needs to take this. And so I would definitely come from the approach of get your bloods checked first to make sure that if there are any deficiencies that you're treating them. If you have an iron deficiency, if you have a vitamin D deficiency, you will likely need a higher amount, and then to get those bloods rechecked again. Yes. So, and then it's looking at if you have any specific conditions like endometriosis or PCOS, there are specific supplements that we would recommend. So when it comes to supplements, what I would say is, particularly during the winter months in Ireland, we should all be taking a vitamin D just because the sun isn't strong enough to synthesize it in our skin between that October and March period. So just your standard dose, you know, your 1,000 to 2,000 international units. But again, get your bloods checked, get your vitamin D levels checked. If you are low, you will need a temporarily higher dose than that. And when it comes to specific conditions, say your PCOS, your endometriosis, your fertility, again, it's not a one size fits all. It's not like I have this one-page leaflet that I say, you've PCOS, you need to take this. But what we are looking for is what are the common deficiencies in PCOS. So people with PCOS tend to have lower levels of vitamin D. They tend to have lower levels of B12.
magnesium, chromium, and zinc.
Okay.
So when it comes to the vitamin D and the B12, again, it's getting them checked in your bloods, seeing if you need a supplement, making sure that you have your food sources. So with the vitamin D, a lot of foods now are fortified in vitamin D,
Yes.
and you also get it. It's rich in egg yolks and oily fish like salmon, your mackerel, your trout. And then your B12 is mainly your animal sources.
Okay.
So if you are vegan, vegetarian, and have PCOS, that's definitely something you want to look into. Supplementing, again, check your levels to see first. When it comes to your chromium, your magnesium, your zinc, they're not as easily tested. The vitamin D and B12 are very easily tested in the blood, whereas testing magnesium, zinc, chromium, that's kind of more in a research setting.
Okay.
So just making sure that you have a balanced diet should ensure that you get those vitamins and minerals. So your magnesium, your zinc, your chromium, they're kind of widely found in your chromiums, your fruit and vegetables, your magnesium, your zinc, your whole grains, your nuts and seeds. So if you have a balanced diet, you should be ensuring that you're getting those. And then when it comes to the inflammation piece, the omega-3 is really important.
Yes.
So we do have very rich sources of omega-3 in your oily fish. So an acronym that one of my dietitian friends gave me, which I love to use for the oily fish, is SMASHED. So you have your salmon, your mackerel, your anchovies, your sardines, and your herring and your trout. So they're all the sorts of oily fish. So salmon seems to be quite a popular one with people. But if you're not getting at least 2 portions of oily fish per week, that's where I would look at getting a supplement in, a good quality omega-3 supplement. With your kind of 2 grams of your good quality EPA and DHA. You do have the plant-based version. So you have your almonds, your walnuts, your flax seeds, your chia seeds, which are really lovely plant-based sources of omega-3, but our body would struggle a little bit to convert to what we need. So I would say that even if you've rich sources of those in your diet and you don't eat fish or you don't eat 2 portions of the oily fish, that's where I'd be saying for PCOS and endo to take an omega-3 supplement.
Okay.
And to take it with food. So that's when it's best absorbed. A lot of people would take it on an empty stomach, take that with food. And then what's really interesting about both PCOS and endometriosis is both of those conditions have been found to have lower gut diversity. So when it comes to their microbiome. So I would definitely be looking at somebody's gut health. So your gut is, as I'm sure you know, so fascinating. There's so many connections with that 95% of your serotonin, your happy hormone, is made in your gut.
Yes.
And your 70% of your immune system cells are housed in your gut. So if your gut's not happy, your mental health, your immune system aren't going to be happy. It's not just about digestion. It's not just about if you're feeling bloated or suffering with constipation, diarrhea. So because that lower diversity is there, the probiotic supplements definitely can have a place there as well. And looking at gut health in terms of your varied diet, making sure you're getting lots of your plant-based nuts and seeds and plant-based proteins, and also your fermented foods. So that would be like your kefir, your kimchi, your sauerkraut, the prebiotics that are feeding those probiotics. When it comes to PCOS, then what is really having a moment right now, and is definitely a deserved moment, is inositol. So that's something I get asked about a lot. And inositol is very interesting. It's found naturally in your fruits and vegetables and your grains. And it's a relative of the B vitamins, but it's very much works similarly to metformin. So metformin, people might have heard of being used with diabetes, and it's kind of an off license for PCOS because it helps to control those blood sugar levels. So
even though they're not diabetic, they have an insulin resistance piece.
Exactly. So a lot of people with PCOS might be put on metformin. So inositol is this lovely natural form that you can take to help to regulate blood sugar levels. I'm not saying that if somebody's listening to this that they stop taking their metformin and take the inositol, that you can take both of them together, absolutely. But it's just monitoring for side effects. So, if you're feeling a little bit dizzy, a little bit nauseous, it could be the two of them are working a little bit too well together. So the starting dose for the inositol would be about 2 grams split up throughout the day. So a powder form is a really nice way to take it. So 1 gram in the morning and 1 gram in the evening, and just mix it in with your glass of water and take before your food. So that's definitely something that's getting a lot of attention with PCOS, because there's a lot of really interesting research coming out about not only helping with that insulin resistance piece, but also with regulating menstrual cycles, helping with fertility, ovulation as well. So that's definitely something that I wouldn't blanket recommend to everybody with PCOS, but I would have a conversation with somebody for sure when we're talking about supplements about that.
And another one that I see sometimes on fertility prescriptions is CoQ10. Does that sometimes come up for you in clinic?
Absolutely, yeah. So when it comes to fertility, particularly if you're over 35, I would definitely be recommending that someone goes on coenzyme Q10, because it just really helps with the egg quality. And as we are aging, the quality of our eggs is unfortunately declining, and a woman is born with all the eggs that she's ever going to have, and we kind of, as time goes on, we're losing those eggs. We can't do anything nutritionally to increase the number, increase the quantity, but we can work on the quality. So the coenzyme Q10 is really important to take as well. And you will often notice with a lot of the prenatal supplements that some of the max versions will have the coenzyme Q10 in there. It's important for the males as well to look at taking the coenzyme Q10.
Of course.
So again, not just the females. And it is really important from a fertility point of view with supplements, if you are sexually active, to make sure that you have your folic acid or your methylated folate in your supplement.
50% of pregnancies are unplanned. People always are like shocked when I say that, but it's not that they're 50% are unwanted, it's just that they come along without being planned. So we were always told that in college. It's I remember one of our lecturers saying, in theory, or whenever you're dispensing a contraceptive, that you should also be dispensing folic acid, because if that contraceptive is being prescribed for the on-label use, which is for contraceptive reasons, then in theory that person should also be on folic acid should a pregnancy arise. It's always a difficult conversation to have with the patient, because you're saying, am I not taking this so I don't get pregnant? But it is worth being aware of, I suppose, that look, there's no harm in taking it. We can't get enough from our diet, and it's only going to benefit you and your health anyway. So like that's the way I would kind of frame that.
Absolutely. And I think it's really interesting to have that conversation about supplements with anybody with a diagnosis, and with the endometriosis as well. The omega-3 can be really important for the pain piece there. There's a lot of research behind vitamin D and pain as well. So looking at your vitamin D, your omega-3. And then when you have endometriosis, a symptom that a lot of people experience is very heavy menstrual bleeding, and bleeding a lot throughout the month. So you're losing a lot of iron there. So if somebody is experiencing that heavy menstrual bleeding, looking at getting them started on an iron supplement as well.
Yes, and as you said, on the back of blood tests, that's something that often comes up. Someone might ask me if they're feeling really tired. It will be one of two things, either iron or B12, because they are clinically indicated when someone has symptoms of tiredness, but only if there's been a confirmed diagnosis of low iron or low vitamin B12. So a huge number of women and girls are deficient in iron in particular without being aware of it, and that's never a reason to just start taking it. But even myself as a pharmacist 2 years ago, I went, she's like, your iron's in your boots. Down in your boots. She was like, why haven't you? I was like, I never thought. I'm there preaching it every day to people, and I was like anemic. But the difference it makes, and if I forget to take it for a couple of days, this is me just revealing the tailors make the worst suits. Sometimes I just, if I've forgotten it or if I was traveling, I really notice it's massive, like how much of a difference it can make. And it really, I suppose, matters from my perspective, like the impact that, say if you're anemic and you didn't know and you're doing exams, or like for women who, like, that could be the difference between you getting the course you want in college or not, because you simply don't have the energy or the concentration because your iron levels are low. So like that's how important, like I'm constantly saying I get a lot of mothers with daughters who have heavy periods asking, and I say, please take her to the doctor and get a blood test done, find out how she got low iron, find out how she got low vitamin B12 or something. Don't do anything beforehand, just so they get a clear reading.
Yes.
And then find out, because it could make a huge, like if she's fallen asleep at school, you know, like.
Absolutely. And then, it's looking at as well, how can taking the iron supplement, and then how can your diet help as well? Are you somebody that's not eating a lot of meat or chicken or fish, or those really rich sources of iron?
Yes.
And also, what some people don't know is there are tannins in tea that decrease your iron absorption. We're big tea drinkers in Ireland, and it's not in any way, my goodness, no, don't give up your tea, but just maybe leave a gap of 15 minutes on either side of a meal so that your body has the chance to absorb that iron.
Yes.
Thankfully, a lot of foods now are fortified with iron as well. And your foods that are rich in vitamin C, your fruit and vegetables, they will help your body to absorb that iron. So it's looking at, with the diet and supplements, are you feeling better, or are you going back and getting your iron levels rechecked and they're not coming up? Why was that iron low in the first place?
Yes.
Is there some malabsorption going on? Is there a possibility of celiac disease? So it's looking at, always just getting those bloods checked, doing that detective work, asking more questions. And definitely when it comes to that supplement piece, as you say, don't do anything, because we want to get a true picture and baseline of what's going on before we start anything.
And another question that I often get asked as well, and which you directly deal with, is the fertility piece. So someone might tell me that they've been trying for a while, or and wonder, okay, it's been, I don't know, let's say 6 months or something, and we haven't conceived. But like, at what point do they come to see you? And is there a diet/supplements first approach that is sometimes taken? Where does that kind of infertility piece start?
Yeah. I would definitely say that if you're, as a couple, if you are under 30 and you've been trying for a year, then you definitely need to go and see somebody. And then if you're over 30 and you've been trying for 6 months and nothing's happening, then definitely going to see somebody.
Okay.
And I would say, get involved with a fertility dietitian as early as you can.
Okay.
And it's looking at all of the nutrients that we would look at that are important for conception. I would always say to people, give it the 3 months. That's how long it takes to kind of create that healthy sperm. And then looking at your egg quality as well. That's roughly how long it takes for that egg quality. Okay. So when someone comes to me, I would go through all of the nutrients that are really important for conception. And what we would usually do is look at a prenatal that is having everything that you need in it. And then looking at specifics with the individual. Are they over 35? Let's look at getting them started on their coenzyme Q10. What do their blood tests say? Do they eat the oily fish? They probably need an omega-3 as well. Yes. And from that general diet point of view, it's looking, again, like we were saying about the PCOS and the endometriosis, you want to bring down any inflammation that's there. So there's a lot of lovely research behind the Mediterranean diet. Yes. It comes up again and again. And the Mediterranean diet is really rich in whole grains. It's really rich in your plant-based proteins, your oily fish and your lean meats, and your dairy. So it's looking at, from a Mediterranean anti-inflammatory point of view, how is your diet looking with that? Also looking at a huge amount of evidence is behind the more of the plant-based proteins. So your beans, your lentils, chickpeas, kidney beans, your nuts and seeds. And that has a huge impact on ovulation. So it's not looking at telling people to cut out their meat or that you have to go vegetarian, but it's looking at, do you have any vegetarian meals in your diet? Maybe you could have like a meatless Monday where you're trying to incorporate more of those. Or even if that seems like too big a place to start, maybe looking at, if you're having your bologneses or your chilies, could you add maybe some kidney beans or some chickpeas in there? Yes. If you're someone that just has vegetable soup and bread roll for lunch, there's not a lot of plant-based proteins going on in there. Could you add maybe some lentils in there? So it's looking at where the evidence is behind the fertility and what helps with that ovulation and conception, and how can we add more of those foods realistically and practically into your diet.
Okay. And I'm thinking about your job and the journey that you must go on with people. Like, as in, you must get great satisfaction when someone goes through that journey and then does conceive. I would imagine you have a lot of kind of really lovely success stories.
It's so nice.
Yeah.
It's so lovely. And, you know, I love that part where you're reviewing a patient and they're pregnant, or I suppose as a side note, I want to make it clear that I'm a weight inclusive dietitian. So as a weight inclusive practitioner, we recognize that weight is not the only marker of health, and we take the spotlight off of weight, and we're looking at the whole picture and how the person feels, and that, you know, the weight, I think, is often focused on as the problem. You know, oh, you can't get pregnant, go off and lose weight. You have PCOS, endometriosis, you just need to go and lose weight.
I hear that a lot.
Yeah, and it's, you know, I think women, we've really been done a disservice with that. Definitely. And I love when people come back to reviews and it's those markers that have nothing to do with weight that, you know, we have conceived, or, you know, I've got PCOS, but now I have so much more energy, or endometriosis. I definitely notice that my pain has reduced, and all of those lovely things that nutrition can do, that takes the spotlight off weight for the person.
Yes, definitely. I think that a lot is blamed on weight, and maybe that's what's fueling the increases in, you know, prescription weight loss medications as well. You know, there might be that kind of motivation behind it, which if you're not getting a full holistic view, maybe you go on it through an online consultation without investigating the full cost, and maybe you didn't need to lose that. Maybe that's your healthy weight, or, you know, it's and I love that, actually. I didn't realize that. I suppose as a dietitian you can be classified as a weight inclusive, that takes the fear out of somebody coming to see you, because there's so much embarrassment and shame if you're going to walk in the door and you feel like, oh, here we go again, and the fifth person I've gone to see that's going to tell me that I need to lose weight. Like, why do I put myself through this? Or, you know, so it's exhausting.
And how awful that must be, like that weight stigma that people experience. And I hear that a lot as well, of people being, I was terrified to come to you today. I thought I was going to walk in the door and that you were just going to say, like everyone else or every other practitioner I've been to, just lose weight, that's your problem. And, you know, I think it's so frustrating, because you would, to give people an example maybe that might make more sense to them, is you could have somebody who might go in with high cholesterol and they're in a larger body and they're told you need to just go off and lose weight. And then you would have somebody who's in a smaller body who goes in with high cholesterol, and they might say, you know, maybe we could look at your exercise. Maybe we could look at getting a bit more fiber in your diet, maybe taking some of those cholesterol lowering drinks. And it's, why did you not give that same piece of advice to the other person? Why do they not deserve that? So it's looking at the effect that weight stigma as well has. You know, there's such a huge rise of eating disorders and disordered eating, and that what that must do for people's self-esteem. And, you know, everybody deserves the same treatment and the same access to healthcare.
Yeah. Oh God, I actually have chills with that, because that's just so, like, that is so powerful and so counter to what you see. You know, I if I see calorie deficit on my timeline one more time, and I've never researched I've never looked up how do I get into a calorie deficit, like in terms of like the algorithm being influenced, and yet there it is every single day. And even like, you know, I'm nearly sick of seeing it. And I know obviously it has a role to play in weight loss. If that is a journey that you're actively and positively going on, that you want to go on, that's great. But whether you like it or not, it's in your face is my point. And it's really, really refreshing to hear that there is a weight inclusive approach to everything, and it takes the blame out of it as well, which can only fuel a very complex approach to eating if you're feeling shame on top of going on a journey for your health. A health first approach is what I always like to kind of focus on. Emer, I could talk to you like literally all day. I'm so enjoying this. But I suppose if we were to give people maybe one kind of last piece of advice for approaching a healthy kind of way of eating, whether whether they're PCOS or endometriosis, or they're just going on an intuitive journey, what would you kind of say to someone who wants to maybe heal their relationship with food?
Yeah, absolutely. So, what I would say to everybody is, particularly as women, don't silence yourself. There's a really interesting gender-specific paper that looks at women and their needs, and that women know their needs, but we tend to silence ourselves. And if you do that over and over and over again, there's a cost on the body. So if something doesn't feel right, it probably means that it isn't right, and to go and speak to somebody. But as I suppose a top few tips to start with, are you eating regularly? Are you eating every 3 to 4 hours? Or are you somebody that's skipping meals, skipping breakfast, skipping lunch? How does that feel for you? And slow down your pace of eating, slow down in general, and looking at that. If you want to heal that relationship with food, if there is something here that you've heard that speaks to you, fantastic, that's great. Look more into the intuitive eating side of things. So there is a great intuitive eating book by Evelyn Tribbley and Elise Resch, who are the founding dietitians. If it feels maybe too much to go and see a practitioner and have a one-on-one consultation, maybe even you want to start with that book and reading it and finding out more about it. But what I would say is that if you have any symptoms, go to your doctor, go to your dietitian, but make sure that doctor and that dietitian have a passion and an interest in that area.
Yes, definitely. Thank you so much, Emer. And you can learn so much from Emer's content on Instagram as well. I'll link everything below so that people can find you or come and see you as relevant. So thank you so much for sharing all of you and all of your wonderful knowledge with us today. It was fantastic.
Thank you so much for having me, Lauren. It was great to chat.
Thanks, Emer. That's it for today's episode of The Wellness Script. If you enjoyed it, make sure to hit subscribe and review with 5 stars. It really helps us to grow and keep these evidence-based conversations coming with top experts to help you on your health and wellness journey. You can follow us at Wellness Script Pod on socials for more. And a huge thank you to our sponsor, Sona Vitamins, Ireland's longest established nutritional supplement producer. Catch you next Wednesday with a brand new episode, Your Prescription for Better Living.